Amy Wood, and we're here in Greenville right now with Dr. Cedrek McFadden, our 7 News medical expert, tackling your questions that you've been asking on the 7 News Facebook page. Emma is asking, is COVID-19 as bad as they say?
So if you ask anyone who's been told they have mild disease, a lot of those people will come back and say, it didn't feel anything but mild. People will describe body aches, feeling like there's pain with every breath, and that's mild disease. But there are varying presentations of the disease based on your own risk factors, your own personal medical histories. But it's nothing to be, blasé about. It's a real problem, and it's a real issue when they're trying to recover and breathe and get through the night just with the mild disease.
And the 20% that get the more severe disease, it's pretty serious for them.
It's pretty serious, and many of those patients end up in the hospital, and some may end up on the ventilator, which again, that is very critical disease for those people.
All right. Roberta is asking, wouldn't this spread, COVID-19, start to spread when we're opening beaches again?
So presumably it can be, and that's why a lot of the directives say maintaining that distance even while you're at the beach or when you're in the stores or wherever you may be. But yes, even with being out in the open space, being too close to one another, it could potentially still spread to others.
Ashley is saying, as a medical professional, I'm wondering what Dr. C's opinion is of restarting elective inpatient surgery. Would he want a family member to have elective knee replacement surgery this week? I guess that's the specific question.
I think, most hospitals are taking a lot of precautions. Patients are going in isolated rooms, they're wearing masks, your family members are not visiting you. They're taking all the steps to be sure they have the proper PPEs, the medications that you need to have a successful operation. I think it is safe to presume some of those surgeries now, but again, there's a lot of assumptions that have to take place. Proper testing has to be in order for those surgeries to take place right now.
But it is a different patient experience because you're not having family around you.
It is a different experience, and a lot of patients don't recognize that in some cases they're just being dropped off at the front door and not seeing their family members again until they're being picked up again at the front door.
Different times. Well, Steve says, has the isolation affected the spread of the flu?
So the numbers that are estimated right now from the CDC, they're about up to 62,000 deaths estimated for this year for the flu. This is pretty consistent with the numbers that we saw last year. And so you would think that isolation decreases the spread of any respiratory illness. So presumably speaking, it can, but the numbers right now, the estimates show we're about on target with where we were last year.
And normal death rates for the flu versus COVID-19, how do they compare?
So the death rate for the flu is about 0.1%. That's about 1 out of 1,000. It's really difficult to know for COVID because we're in the middle of this right now. But just think about this. At one point, the death rate in New York was 0.1% of the state of New York, of the entire population. So you think about the country, it's expected to be a little bit higher than the flu. Initial estimates were about 10 times higher than that of the flu.
All right, Dr. Cedrek McFadden, tackling your questions. You can still add yours to the 7 News Facebook page. We'll still be doing this next week.
Yes,
thank you.
Thank you.
And thank you, Amy. Every day there is new information on the coronavirus crisis and its local impact. And you can, of course, depend on 7 News to bring you the very latest on air and on WSPA.com. You've seen that banner at the top of your screen saying coronavirus. Just click that for all the information you need.